Namaste everyone. On the behalf of Paavai Institution, I welcome you all to this Let's Talk event. Let's Talk event. It is a monthly event where we talk with people of great eminence to gain knowledge as well as wisdom. People in the society usually overlook many unsung heroes and take inspiration from celebrities. But we are here to bring those unsung heroes on the stage to create an opportunity to learn from them. Today, we are here to grace the journey of one of the most celebrated interventional cardiologists, Dr. Deepak Krishnamurthy, a senior consultant interventional cardiologist at Sakra World Care Hospital. He is one of the eminent cardiologists who has been awarded with Vassar Gold Medal for his outstanding performance in DNB cardiology examinations at all India level and is a recipient of 7 gold medals and 3 awards by the University of Mysore. Welcome, sir. To start this session, could you please tell us about yourself, sir?
So, my name is Deepak Krishnamurthy. I was born and brought up in Mysore, Karnataka. I did my education up to schooling and then up to MBBS there. Then I did my MD medicine, general medicine from SMS Medical College, Jaipur, Rajasthan. Before that, I did my MBBS from JSS Medical College, Mysore. Through the All India entrance, I got selected. I chose general medicine in Jaipur, where I was there for 3 years. Then I came back to Bangalore. I joined cardiology at Sahitya.S.S Institute, Whitefield, where I did my cardiology training. Now I work at Sakra World Hospital, Bangalore, as a senior interventional cardiologist, basically a heart specialist. My parents were G.A. Krishnamurthy, my father, who was a manager in State Bank of Mysore. My mother, Padma Murthy, is a homemaker. I have an elder sister, Vijaya, who is also a homemaker. Currently, I live in Bangalore with my wife, Varsha, and my son, Aditya. My son is in 10th grade now. My wife is a teacher. She teaches in 3rd and 4th grade in the same school where my son studies. She teaches English and science. That's briefly about me.
Wonderful, sir. What motivated you to specialize in interventional cardiology?
So, first I did my MBBS. At the end of MBBS, I actually wanted to be a surgeon. But somehow after finishing my internship, I was not that inclined to get into surgery. But I wanted to be in a branch where you treat patients with medicine, as well as I was interested in doing procedures, like surgeries, other procedures. So I was interested in that. And as you know, heart diseases are one of the commonest causes of death world over, and one of the commonest life-threatening diseases which are present in the society. So I wanted to be in a branch.
Yes,
Initially, I wanted to be a cancer specialist when I was doing my MD medicine. But then later I shifted to cardiology because, as I told you, I wanted to specialize in a branch where there are procedures to do like surgeries. So interventional cardiology is somewhere in between medicine and surgery, if you look at it. So you not only treat patients with medication, lifestyle changes, and dietary advice and all that, but we also do procedures like angiograms. We also do procedures like angioplasties and stentings, pacemaker implantations. So it is a branch which is in between surgery and medicine. So since I wanted to be a surgeon initially, I didn't want to give up on that totally. So I took up interventional cardiology, which is in between medicine and surgery. So you get the satisfaction of being a physician. At the same time, you also get the satisfaction of doing some procedures, which is interesting and something I like doing.
Could you describe a typical day or a week in your role as an interventional cardiologist?
Yeah. So typical day, I wake up in the morning. I wake up usually early by 5:30. I do some exercises. I go for a walk or do some stretching exercises, some weights. Then I have 4 cats at home, so I feed them, play with them. Then I help my wife a bit in the kitchen. I help my son pack his stuff, sit with him and talk for some time before he leaves for school. Then I get ready and leave for work. I'm usually at hospital by 9 o'clock in the morning. So a typical day, I see around 25 to 30 patients on an outpatient basis. Patients coming with various cardiac problems, high blood pressure, cholesterol, heart issues, and if they are very serious or sick, I admit them to the hospital and treat them further. Plus, during the day or during the off hours also, 9 to 5 is the usual working day. After that, in the evening, I'm at a clinic where I again see some more patients. But during the day or night, if there are emergencies, people coming with heart attacks, people coming with acute emergencies, I attend to them. I perform their angiogram, angioplasty, and stenting, which is usually a life-saving procedure. Sometimes it may be an elective procedure. The patients whom we see in the OPD having certain problems which are not getting solved by taking medicine, which are not getting solved by only lifestyle changes or dietary changes. Then we admit them if they have symptoms like chest pain, breathlessness, palpitations. We evaluate them, perform angiogram, and if blockages are found, I perform their angioplasty and stenting. Some patients may require pacemaker implantation. Some patients may require other procedures. So this is a typical day for me. Of course, alternate days, I am on call. On call means anytime during 24 hours, if there is an emergency, they'll call me and I'll have to go to the hospital, treat that patient, take care of the patient, make sure that the patient is okay. And on Sundays I'm usually free, but alternate Sundays I'm on call. So although I'm at home, in case there are emergencies, I may have to go. That is how typically an interventional cardiologist's day and week looks like. Monday to Saturday. In India, we work 6 days a week compared to, say, abroad in US or Europe, where they work 5 days a week. We typically work 6 days a week. That is how it is.
It must be a one hectic week, sir. What are the common cardiovascular diseases or conditions that you treat as an interventional cardiologist, and how can we prevent them, sir?
So the commonest problems we treat cardiology include high blood pressure or hypertension, high cholesterol or hypercholesterolemia, heart attacks, heart failures. Patients with rhythm disturbances, heart going either too slow or too fast or irregular. Among these, I would say blockages in the blood vessels of the heart, which can cause chest pain and such symptoms, or acute blockages causing heart attacks are the commonest problems we treat. Uh, how to prevent such problems? The basic thing is to have a good lifestyle, regular walking and exercise, being physically active, um, following a healthy diet, avoiding junk food, avoiding eating too much of sweets and sugar, reducing the intake of oily food and deep fried food as much as possible, reducing salt intake, eating more fruits and vegetables. Smoking is one important risk factor which can cause heart attacks, so one should not smoke to prevent heart problems. Being sedentary, being sitting in the same place, sitting in front of the TV or your gadgets or mobile for a long time, not exercising, not moving around is another important risk factor. Stress is a very important risk factor. And if somebody has diabetes or high blood sugars or high blood pressure or cholesterol, should see a doctor and treat that properly so that heart problems can be prevented. Heart problems do not happen because of one single reason. For example, if you have typhoid fever, you have a bacteria, salmonella, which causes typhoid. If you take malaria, there is a malarial parasite, plasmodium, which causes malaria. Whereas heart problem is not due to one particular reason. Many risk factors are there: smoking, cholesterol, blood pressure, sugar, family history of having heart problems, being sedentary, not exercising, smoking. So if you have too many risk factors, you tend to have a high probability of having heart attack. In mathematics, you would have read about probability. So if there are certain conditions, then the probability of heart attack being there is very high. If you prevent those risk factors, you can prevent heart attacks to a large extent. So it is about increasing or decreasing the probability of getting a heart problem. So that is what it is about. So that is about the common conditions we treat and how to prevent them. Of course, following yoga, meditation, uh, reducing your stress levels also plays a very important role. Getting adequate sleep is very important. As students, you all need to sleep at least 8 to 9 hours every day to have good memory and retention power. Similarly, adults also need good amount of sleep in order for the body to repair itself, body to heal itself, and for the blood pressures and other things to settle down and to prevent heart problems as well.
What are some of the latest advancements or technologies that has been introduced in interventional cardiology?
So the latest advancements, if you talk about in angioplasty, where we do a ballooning of the blocked blood vessel and put a stent, several advances have been made. In some people, there is a hardening of the artery with a lot of calcium deposition, making the blockage very tough. If you just balloon it and try to put a stent, it is not possible. So there are techniques to dissolve the calcium or break the calcium, what we call as intravascular lithotripsy. Earlier, we used to use this technology. Now also it is used for breaking kidney stones. A similar technology has come into angioplasty now, where we can use balloons, special balloons, to break through the calcium, what we call as intravascular lithotripsy, meaning you're doing lithotripsy or breaking this calcium inside the blood vessels. There is also use of laser in treating blockages like calcific, having a lot of calcium and hard blockages. You have now imaging techniques like how you do ultrasound of the stomach, how you do X-ray and imaging of the brain. Similarly, you have what we call as intravascular imaging, where we pass a small tube inside the blood vessel of the heart, and we can image how the blockage looks, how tough it is, how much calcium is there, what is the length of the blockage, what is the width of the vessel, and accordingly plan our intervention more precisely. To the millimeter level, we can plan the intervention and put the appropriate sized stent and deal with the blockages. These are some of the advances in dealing with blockages of the heart. Then there are a lot of innovations and newly available pacemakers and devices. For example, we have something called ICDs, which are special pacemakers which keep monitoring the heart. And if somebody has the possibility of getting a cardiac arrest, it can shock the heart from within and bring it back to normal, what we call as ICDs, or implantable cardioverter defibrillators. You have pacemakers which can improve the heart function. In heart failure, it is used, which is called biventricular pacemaker. Then we have now earlier, anybody who had a blockage in the heart valve needed open heart surgery. Now there is an alternative available in patients where, like doing an angioplasty percutaneously going from the groin, we can go to the heart and implant a valve. Instead of doing open heart surgery, you can implant a valve, what we call as TAVI or TAVR, where we implant a valve percutaneously without surgery. So there are a lot of advances in cardiology in every area. Now you can perform, you can close holes in the heart without surgery, what we call as device closure of holes in the heart. In rhythm management, in rhythm disturbances of the heart, there are a lot more advancement. Even when it comes to medication to control blood pressure, to treat heart problems, there is a lot of advancement going on, because of which, if you compare to say 30 years ago or 40 years ago, heart patients live much longer. Even after getting a heart attack, it is possible to live. It is possible to live a normal life. Even after getting cardiac complications, valve problems, or rhythm problems, you can live a normal life with the aid of all these technology used judiciously. So one may ask, so technology is what is important? How is the doctor important? The right use of the technology in appropriate patients who need it, and deciding which patient needs what, is the job of the doctor. That is where the doctor comes in. We have to understand the technology. We have to understand the plus and minus of each technology, and then appropriately use it to the benefit of our patients. It is not that every technology can be used in all patients. That will make it very expensive, very costly, and you may not need it in everybody. So it is the job of the doctor to understand the technology, understand the patient's condition, and then use appropriate technology to help each patient. Now artificial intelligence is coming in. It is coming into medicine also. So people think, okay, artificial intelligence has come, so we will not need doctors. No, any technology comes, we have to understand that we are treating humans. We are not repairing machines. We are not fixing up buildings. it is a human body you're talking about. A human being is not just the body, but also the mind, but also the soul. So you have to understand each person's needs, each person's each person, how they're dealing with disease, and treat the disease to the fullest. You don't treat the disease, you treat the person. The person sitting there is a human being, and that human touch will always be required, no matter how much technology advances. So the doctor's role becomes that much more complex in future, because you have to understand technology, you have to understand artificial intelligence. At the same time, you cannot lose human touch to treat patients.
It's really interesting. So, can you please share some of your memorable patient success stories where you had made a significant difference in their lives?
There have been many. To recall one or two, see, recently we had a patient who came with a cardiac arrest. So we revived him. He came back to normal pulse and blood pressure. He was on ventilator because he couldn't breathe properly. His heart pumping was just 20%. So we admitted him, stabilized him on medication, treated his infection. Then after that, we were able to implant a pacemaker, what we call as a ICD, which I told you about, which can shock the heart and bring it back to normal in future if there is a cardiac arrest. So this person made recovery. Then again had some problem. Again he had to be put on ventilator twice, and then again he came out of it. Then finally went home. Now he's coming for regular follow up, and he's walking around. So when a person is almost dead with a cardiac arrest and we revive him and he makes good recovery and comes back to us walking, talking, it is one of the best feelings a doctor can have. No amount of money, no amount of material things in the world can match that happiness of the doctor and all the medical staff who are involved in treating that patient. Similarly, many years ago, I had treated one boy some 10, 12 years ago. That time he was just 4 or 5 years old. He had some heart problems. I had treated him, and he has been following up with me every year. During COVID and the pandemic for 2 years, he was not able to come. And then 3, 4 months ago, he suddenly came to the OPD. He's a grown up 16-year-old boy who's almost as tall as me. When I had last seen him, he was a small boy whom I remembered, and now he has come up. He's grown up. He's in 11th standard, and he recognized me when I was walking in the hospital, and he said, "Hello, sir. How are you?" I couldn't recognize him, and then when he showed the papers, I was so emotionally moved and touched, because this is the same boy who was like 4, 5 years old with a heart problem, whom I treated years ago. Such moments are very common in the medical profession. The amount of professional satisfaction, the amount of happiness you get, and the amount of gratitude you receive from people is amazing. So of course, it is one of the toughest professions to be in. It takes a long time to study, to get established, to start your practice, to see patients, to gain enough experience and knowledge to deal with all kinds of problems. But at the same time, it is a very, very fulfilling profession. Emotionally and mentally, the amount of satisfaction it gives you for the amount of hard work you put in is, according to me, you cannot compare it with anything else. So people ask me, suppose you are given one more chance, do you want to still become a doctor? I would say always. Every time I'm given a chance, I would be a doctor, nothing else.
It's truly amazing. So, in your opinion, what are the essential skills or qualities for someone pursuing their career into interventional cardiologist or doctor in general?
To become a doctor in general, I would say you have to have the passion to deal with human beings on a day-to-day basis. As I told you earlier, we are not repairing machines, we are not fixing up buildings, we are not putting up roads and infrastructure. These are living beings. We are talking about people who can talk, who can think, who can feel things, and each person is different. So you deal with human beings on a day-to-day basis once you become a doctor, and human beings come with a lot of emotions, feelings, different thought processes, different cultural backgrounds, different religions. So you have to have that capacity or that patience and that aptitude to imbibe all that, to establish that connect with each patient, to understand what they're going through. Of course, science is one part. You need to be knowledgeable, You need to study hard. You need to get through the course like MBBS, MD, and later whatever. It's a lot of hard work academically. That is one part. But as a human being, as a doctor, even after getting a degree, there is a lot to learn. Even at this stage, I am 47 years old now. Even today, I learn every day how to communicate, how to put certain things in a better way. As doctors, there are many times when we are not really able to help a patient. The patient may not be doing well. We are trying our best, but you need to communicate. You need to tell that to the patient and their relatives. How you communicate, how you tell that to them without hurting their feelings, without making them feel bad, uh, making them understand the disease process, the healing process, at the same time, not to feel them, not to make them feel scared, not to make them have unrealistic expectations. All these things make a lot of, take a lot of toll on your emotional and physical health as a doctor. So one needs to have that patience, one needs to have that aptitude, one needs to have that passion to deal with all these things apart from academic work, apart from skill set you need to have as a doctor to treat patients, apart from the learning and the degrees you need to accumulate. You need to be having this aptitude and this eagerness to serve people. At the end of the day, you have to serve people, make them better, make them happy, and have excellent communication skills. Earning money is one part. Of course, as a doctor, once you reach a certain stage, you will earn comfortable amount of money to live a good life. But you need to have all these attributes or characters, or uh, to become a good doctor. And the learning never stops, because medicine is a field where there is a lot of research going on, a lot of new things coming up every day. You need to learn, you need to read, you need to apply that in your patients. You need to decide what is good for my patient, what is not good for my patient. On a daily basis you learn and improve. There are doctors who have been working at the age of 90. There was a great surgeon, Ibeki, US, who operated till he was 100-year old. So learning never stops. And that way one needs to understand that this is a profession which needs lifelong commitment, and understanding of human beings and dealing with human beings, which is not an easy thing to do.
It's really a valuable message for all young doctors out there. Sir, apart from being a very successful doctor, you have got 50k followers in your Twitter account. Tell us something about your social media success.
My main idea of being on Twitter, uh, main purpose, is to have a connect with people. Say, as a doctor, uh, of course, you have your degree, you have your job, you have your patients whom you treat. At the same time, a doctor has a social responsibility of creating awareness. See, the more you create awareness about health as a doctor, the more you create knowledge base about common disease conditions, how to prevent them, how should be your lifestyle, how should be your diet, what you should do in case of emergencies. Every doctor, irrespective of field, maybe a cardiologist, maybe a kidney specialist, maybe a neurologist, maybe a respiratory specialist, we all need to contribute by creating awareness, because the more aware the people are about diseases, the easier it becomes to treat them, to prevent diseases, and to help them. Because when it comes to prevention of heart attacks, prevention of disease in general, to maintain good health, health awareness, health education is very important. And in our busy schedules, it is not possible to go out to give speeches and lectures to people all the time to make them aware. So, social media is a very good platform where you can put out content which is scientific and valid, and as per current guidelines and scientific basis, which people can understand, which people can implement in their day-to-day lives. Of course, part of it is de-stressing in the form of putting some pictures, putting something about yourself, what you do on a day-to-day basis, some entertainment, some music, movie-related stuff. I keep posting about my cats also. Those are other. So whenever I find time, when I'm commuting to the hospital, I have a driver for myself. So I get around 45 minutes in the morning and evening. That is the time when I usually put out my tweets, or I'm awake in the morning early. That is when I put out my tweets. So my main purpose is to create awareness, and people have liked that. When we tell something to a patient as a doctor, we tend to use a lot of technical words, a lot of words which are difficult to understand. But when we're trying to create health awareness, we have to speak in the language of the people, what they understand. If I say myocardial infarction, 90% of the people will not understand. If I say heart attack, 100% of the people understand. When I say hypertension, very few people may understand. When I say high blood pressure, they all understand. So you have to use common language, easy to understand language, and make some important points and emphasize them again and again. See, today if I write about heart attack, some 500 people will like it, some 1,000 people or 10,000 people will read it, they'll forget. But a week later, they'll forget about it. So you have to constantly engage people when you want to create awareness, constantly post health related stuff. I generally do it in the form of some case which I saw, something I treated, some emergency which happened, some misconceptions which are common among people, which makes people connect with the account, which makes people relate to what they're undergoing in their day-to-day life, what they've seen in their day-to-day life. And that is how I think it has become successful, as you may call it. But my main purpose is creating awareness, and even if I'm able to create awareness in a small number of people, it is a good thing, I feel.
Do you think prevention is better than cure?
Absolutely. See, when it comes to treatment of diseases, say once somebody has developed cancer, once somebody has developed a heart attack, once somebody has already developed a stroke or a kidney stone or anything, any disease for that matter, the treatment is expensive, the treatment is painful. It takes time to recover. Some people may not recover, there may be complications. Preventing it, on the other hand, takes effort and patience, but the cost is very minimal. You do not have to undergo through the pains of the disease and its complications. And once somebody, see, preventing a heart attack is about good lifestyle, diet, stopping to smoke, all these factors I mentioned earlier. But once you get a heart attack, from the point you get chest pain, whether you really reach the hospital or not, after reaching the hospital, whether you'll get timely treatment, and after getting timely treatment, whether you'll make full recovery, everything is question mark. You really don't know how things will go once a complication happens. Whereas prevention, if you stick to it on a regular basis, it is possible to prevent a large number of diseases, cancers, heart attacks, heart failures, strokes. Simple thing, controlling blood pressure, keeping it normal, can prevent 60% of the heart attacks, can prevent 50% of the strokes, can prevent 70% of the kidney failures. So the impact is huge. Stopping to smoke can prevent a large number of cancers, can prevent a large number of heart attacks, can prevent a large number of lung disease. So the scope of prevention is huge. But the problem is, prevention has to be an ongoing thing. You cannot do prevention today and forget about it tomorrow. Every day you have to adopt a certain lifestyle, exercise, stopping to smoke, doing more physical activity, eating healthy. This has to be a lifelong commitment. People have to understand the importance of that, and it is absolutely important that we prevent a large number of diseases rather than allowing diseases to develop and then try to tackle them.
At these modern times, no age is exempted from heart diseases. Can you share some of your tips or techniques for our viewers to lead a healthy and a happy life?
So, as I told earlier, in India especially, and some of the other Asian countries, young heart attacks have become very common. People getting heart attacks below the age of 40, below the age of 30, something we see commonly. Mainly because there is a lot of smoking, there is a lot of stress, there is a lot of pollution also in most of our cities. Unhealthy eating, overeating is very common. There are a lot of junk food. There is a lot of junk food available out there. Lot of intake of sugar, sugary drinks, and sweets. Uh, More calorie intake, less physical activity, more stress, more pollution, smoking. All these have led to heart attacks among young people. As Indians, we are genetically more predisposed to develop heart attacks. So we have to make doubly sure that we stick to a healthy lifestyle, not smoke, not overeat, exercise regularly to prevent these problems. Uh, so keeping our weight ideal. Simple way to calculate ideal body weight is you measure your height in centimeters, say 170 centimeters. 170 minus 100, 70 kg is your ideal body weight. If you're 180 centimeters in height, 180 minus 100, 80 kg is your ideal body weight. All of us should know our ideal body weight and try to maintain that. The other thing is our tummy. If your waist circumference is more than 50% of your height, say your height is uh, 6 feet. 6 feet is 72 inches. If your waist is more than 36 inches, it is a problem because fat tends to accumulate in the belly. And belly fat is known as an important risk factor for heart attacks. So keeping your waist slim, keeping it below 50%, that is the circumference of the waist to height ratio, we call it. Keeping belly fat minimal or zero is very important. If you have belly fat, you can develop diabetes, you can develop high blood pressure, you can develop heart attacks. If you don't have belly fat, all these risks will become very minimal. A lot of people ask, we are not as fat as Americans, we are not as fat as Europeans. Why do we develop heart problems? Belly fat is the answer. Belly fat, even if you're not overweight, even if you're not very fat, the accumulation of fat in the belly is a major risk factor. This, along with smoking, sedentary lifestyle, overeating, eating junk food, eating too much sugar, not exercising, these are all the main risk factors which we need to be aware of and prevent.
So, before we wind up this session, could you please tell us about your recent tweet where you have received a heartwarming letter from one of your patients?
See, this gentleman, he's 75-year-old. He has been my patient for the last 10, 12 years. So I saw him some 10, 12 years ago. He was having some heart problem. Then we did his angiogram. He had multiple blockages. Then he underwent a bypass surgery. Then after 2, 3 years, because of his food habits, he developed more blockages. I had to do an angioplasty, put a stent. Then he was doing fine. Of course, he's very fond of junk food. He's very fond of eating, samosas and kachoris and all kinds of stuff. Although we keep telling him to stick to a good diet. Recently, he developed a tumor in the jaw. Okay, tumor in the jaw was so big, it was occupying the entire jaw almost. So they had to admit him. They had to remove almost 80-90% of the jaw. And then they had to take a bone from the leg and reconstruct his jaw. It's a major surgery. Any surgery involving the jaw and face tend to be very complicated. Of course, our doctors did a good job. They reconstructed the jaw and everything. But unfortunately, because of his age, because of his diabetes, he developed some lung infections. Then he developed some infection in the wound, which was the surgery wound. Then he had difficulty breathing because the jaw was all jaw and mouth, everything was swollen up. So they had to put a tube in the trachea, what we call a tracheostomy. So he was in and out of ICU 2, 3 times. Then finally, after 2 months of struggle, lot of ups and downs, he recovered and went home. And he's on physiotherapy, he's on rehabilitation. Slowly, he has been improving. He was fed through a tube going through the nose. Then finally, he started to eat some liquids and semi-solids through the mouth now. Soon they're going to put dentures to him, so he'll be able to eat normally like any of us. So the first thing he says is, once I get my dentures, he wants to eat one samosa. After going through all this, we are like, it's okay, you eat whatever you want to eat, but as long as you have recovered and doing well, that's more important. So this patient came back yesterday with his daughter. They wanted to thank the entire team. They met me because I was their primary cardiologist. Then they met the surgeon who operated. Then they met the physiotherapy team, the ICU team who took care of the patient, the ENT doctors who took care of the tracheostomy. So see, in a big hospital, in a multi-speciality hospital, many patients have many issues. It is not just one disease. They will have many problems like diabetes, blood pressure, heart problem, the surgery they have undergone. So they need a multidisciplinary care. So after all the fight and battles, this patient finally recovered and is, it was a very happy and emotional moment for all of us to see him normal and asking for a samosa.
Thank you, sir, for spending your precious time with us.
Thank you so much.
I'd also like to extend my heartfelt gratitude to our chairman, Shri.C.A.N.V.Natarajan sir, correspondent Srimati Mangai Natarajan ma'am, director Dr. C. Satish sir, principal Mr. Rohit Satish sir, headmistress Mrs. Niranjani ma'am, headmistress of Salem campus Mrs.Seena Hariharan ma'am, Paavai faculty members and technical team for supporting us. We will meet you soon in another Let's Talk event. Until then, take care.